Hi guys, and welcome back to my YouTube channel. So guys, it's been a minute. It's been literally like what? Oh, like a month since I started my treatment. So I wanted to give you guys a big old update on everything that's been happening or has happened. Some of it has been a lot. Some of it, I'm not gonna lie, I was in the trenches, but you guys know me, I'm always like going to remain positive and fight through. But let me just give y'all at least insight of what happened to me and potentially what other people can expect. Again, it might not happen to you. I pray some of the things doesn't happen to you, but some of these things happen to me. So let's now get into this video. But guys, before I do, please don't forget to like, comment, subscribe. You already know, road to 30K. Alrighty guys, so of course the first step of the treatment was 3 days worth of chemo. The first day was 30 minutes, so uneventful of chemo. Second day, again, also very uneventful. However, on the third day, I was given two types of chemo drugs. One is the one I was having for the past 2 days, and the new one was cyclophosphamide, and I had it for an hour. The other one was for 30 minutes. So I don't know. Still to this day, I don't really know what caused it. But when I got back to the apartment, I made a TikTok video and I was very out of breath and my voice was, I guess, a bit weird. I didn't notice it was weird, but one of my friends that watched my TikTok noticed that it was weird. So later on in that day, I was trying to record a video for Love is Blind. However, my voice was just changing. I cannot pinpoint what the cause was. I just couldn't tell you. Like I was losing my voice and then I was losing the ability to speak. The best way I can describe it, I mean no offense to nobody, it's almost like someone that has cerebral palsy that hasn't had speech therapy. Like, I'm going to show you guys a clip, but this is not even the worst of it, but I'm going to show you guys a clip.
Will come out of this. I think it's better to see people in motion. And I definitely think people are more attractive in motion. I don't know if I can do this video. Hi guys, and welcome back to my YouTube channel. So this is the third or fourth time I'm doing this introduction because my voice is changing because of the chemo. I don't even know why I'm speaking like this, but I think it's getting, hold on.
So that's how I was sounding. There was times where I could not, like my voice was going so high. You guys know I don't speak like that. I could not even film the video. I tried 6 or 7 times to film the video and I just couldn't do it. And it was so disheartening because you guys know I do not have an issue with speaking. That is not my issue. But to be losing my voice and not knowing why, and this is not a symptom or a known symptom of the cyclophosphamide or anything, it just was odd. And it was like, am I having neurological problems? Like, what is going on? So I just thought, you know what? It shall pass. Let me just carry on and let me not raise it. I didn't feel like it was worth raising. I just thought it will come back. It's fine. And there would be times where I could speak for 5 minutes and then my voice would go and I'll just have to like stop speaking. So then my sisters and I were watching Love Island and we were talking during the breaks because we always do that. However, after the first break, I think I'd spoken too much. So I burnt out loads of energy and then I found myself not being able to breathe. So this is like 9:15 on a Friday. I could not breathe. And then I think I started panicking because I could not breathe. And I was trying to catch my breath and then it felt like my tongue, the placement of my tongue was in a completely different place. So even to breathe in and out through my mouth, I was struggling. Then my nose, I was struggling. So I looked at the piece of paper that they'd given me previously to say like, call us if any of these things happen. And shortness of breath was one of them. So I called them and they were like, go to A&E. So I literally, thankfully, most of my bag was already still packed from me going to the hospital earlier on in the day. I chucked my portable charger and my big headphones and just maybe a snack or something and went straight to A&E. So, mind you, at this point, I go to A&E. I tried to go through the back entrance and the back entrance is closed and I'm thinking, God, I actually can't breathe and the door is closed. Like, but it wasn't even to A&E, that was to the main part of the hospital. So I go round and I find A&E. Now, A&E on a Friday is crazy. And A&E on a Friday needs to go where? In the bin. Because guys, I'm not gonna, do not recommend. 0 stars. Because there's a lot of things going on a Friday in central London. Like a lot, like I saw a woman that looked like battered. Man had blood on him. People were like, one man, I don't know if he was in, like, I don't know if he had all his senses, but he was talking about someone R-ing somebody, and he was looking at some guy, and I was just like, Nicole, don't look at him because he looked like he was on some, I don't know what he was on, but there was just a lot of different things going on in A&E, and I'm just thinking, I can't breathe. Lord have mercy, give me strength. Like yeah, it was a lot. It was a lot. So after I went to A&E, thankfully I was put in a room, maybe after like 30 minutes, and then I was seen by a nurse, and I was explaining what the issue was, but even still, I couldn't even really explain because my voice kept on going. So she would tell me to breathe in and out, to the point where I couldn't even breathe in and out. I was literally snoring, like I was snorting, because it's almost like my nose was blocked. Like this part of my face just wasn't working properly. And I'm just like, what is going on? What is going on? What is going on? It was quite, like, it was strange. And then three different doctors came in, and ultimately it kind of resolved itself. I think I was in the A&E for 4.5 hours. And so I was there from 9:30 to, I think, 2 o'clock in the morning. Is that, no, I think that's 5.5. Is it 5.5 hours? Okay, 10, 11, 12, 1, chill. But no, it's 4.5 hours. Sorry, I'm just trying to do the math. But yeah, I was just there for ages, and I was just like hoping that things were going to be fine and da-da-da-da. But I think it just resolved itself. I literally napped when I was at A&E, and then I woke up and they said, we can't find anything wrong with you. Just go, like you can, like, I was discharged. So I was glad to be able to go home, but I was in fear because I was like, do I even want to sleep? Like, if I sleep this sleep, like, I want to sleep right now, am I going to be able to wake up? So even though nothing happened, even though they didn't do anything for me in A&E, there was still some sort of safety that I was at least in the hospital. But going back to the hotel, I was just like, God, please let me wake up. Like, please, 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 and more please, allow me to wake up. And yeah, so that was that. And I definitely think during that period, my face was getting swollen. And I definitely, like, my belly was, I had like chemo belly, I would say. I think I researched it and that's what they call it. Like, my belly was getting swole. My belly was definitely swole, and I was definitely having fatigue. So I was napping a lot as well. So that was just a lot. So that's day 3. Day 3 of chemo was so dramatic. So this is not day 3 of the treatment. This is pre-treatment now. So that was scary. So that was on a Friday. Then Saturday, it was pretty much fine. Like, I still had moments of the voice changing, but not to the same degree as it was previously. So I still kept on going to the hospital, to where I was supposed to go, to the hospital, to get like little bits of like, oh, get some magnesium, get some sodium chloride, things that I just needed at the time. So those things I needed more so because of, like, I have, like, my kidneys are just overactive. So I just needed those things. But my voice, it was better, but I was still having moments of when my voice was going, and I found it difficult breathing. So day 5, which was also supposed to be a rest day, I was supposed to be in the hotel. I went into I went to the hospital to go do just my regular stuff, like, again, get sodium chloride or whatever. But then while I was there, they literally called me and was like, Nicole, you need to go and pack. My blood results came back, and my creatine, I think it's called, or creatine, something like that, it's called something like that, was super duper high, like super duper high. So they're like, we need to like bring you into the hospital ASAP. So I was supposed to be admitted onto the ward on the Monday, but I was admitted on the Sunday. So I literally packed all my stuff and everything, and I was seen by a doctor, and that was the worst day, I would say. Sunday was the worst day in terms of my speech, because it got to a point that I couldn't even speak. I had to type. Words could not even come out of my mouth. And the thing that it was quite difficult to explain it to people, because they're probably thinking, what's she even on about? And how is this even possible? But I just could not speak, so I had to type. And it wasn't that my mind didn't know what it wanted to say. So I was like, I don't think it's a neuro issue, but like, it's not that my mind didn't know what to say. I just couldn't communicate it. So that was quite like disheartening, because it was like, is this getting worse? Is this a thing now? Like, this is an unknown symptom of anything. So that's why they just chalked it up to me being anxious. But guys, fundamentally, I'm not an anxious person. I can get stressed out and I can get irritated, but I'm not really an anxious person. I've never really described a moment or something. Like, I'm just not really that type of person. So, but that's what they chalked it down to. I think it's almost like when they don't have anything else to say, they just say anxiety, because my conscious mind wasn't anxious. I was very excited about the treatment. So I don't know. So while I was editing, I didn't mention that I actually used the videos that I showed you guys. I had a lot more, but the videos I showed you guys is actually really good to have, because I showed it to my doctor. So because they couldn't really understand what it looked like and how it actually like actualized, it was really good to have those videos so I could show them what I was speaking about specifically, which I think helped them understand it, because sometimes it's hard to advocate for yourself when it's not something that they're in the know about. Like, this is not something that happens. I don't think it's even like a rare symptom. It's like a no symptom. So it was good to have those clips. But anyways, so yeah, that was very, very disheartening. And then they ended up running some like really basic neuro test on me, and that all came back fine. So then they were like, okay, but before we actually start you on your CAR T therapy, we need to figure this out. We need to see if there's something here. So I was given a CT scan, and that came back negative. So I was like, okay, we need to do a more in-depth one. Let's do an MRI scan. So I was like, okay, fine. That's okay. I was like, but then the MRI scan wasn't scheduled until Tuesday. So I was admitted in on Sunday, and that means I had to wait Sunday and Monday, and then wait Tuesday. And if everything was fine, then I could get the treatment on Wednesday. Mind you, I was supposed to get the treatment on Monday, but of course it would be negligent of them to give me the treatment without knowing what was going on with me. So that was that. I really had bad sleep that day. I think then I started to be anxious. Then I was worried. Then like, I think it was very uncomfortable sleeping, because I was like, I don't know what's happening and I have zero control over it. So that sleep I did that day was uncomfortable. And also I was told that because I'm an inpatient, I would need to get blood thinners every day, guys, because of course you're in bed most of the day and you're walking around. I mean, you're not walking around, you're literally just chilling most of the time. So, and I hated the blood thinners. Honestly, every single time the nurse came to give me the blood thinners, I was like, why are you back again? Well, honestly, the nurses at the hospital were absolutely, and the doctors were absolutely amazing, especially those nurses, because those are the people I interacted with the most, and they were just so amazing. I had, like, being at the hospital was not even bad at all, because the nurses were so good, and the staff in general were really, really good. So, day six from when I had the chemo, like I said, it was delayed and everything like that, but it was what it was. And then again, TMI, but guys, I started spotting. So they put me on different contraception that I usually am on. I'm usually on the combined pill, but they put me on the I think it's called pedestrian. No, pedestrian only. I don't know. You know what I'm trying to say, but I've never been on that pill before. It's POP, I think is the acronym. And then that caused me to like start spotting, and then I ended up like. And that was quite annoying, because I didn't know they were going to switch my pill, because the combined pill, they say it can cause blood clots. And of course, me being in the bed all day long, they didn't want it to interrupt or cause a blood clot, which of course makes sense. But they didn't tell me in advance that they were going to swap out my contraception, because I brought little girl undies. I did not bring my big, you know what I mean? Y'all, women in that's watching this video, y'all know the period underwear. I didn't have my big, like, nappy type stuff. Like, and then also they said I couldn't wear tampons because of, like, the toxicity behind it. And I'm like, so y'all really want me to have a whole period with pads and little underwear? Like, I was like, I'm actually suffering. So anyways, day 7 comes round. I did the MRI scan. It all comes back clear. So they gave me the go-ahead to have CAR T the next day. And like I just mentioned about the whole like period thing, and that was quite stressful. I wish they would have told me in advance, because it's, you know what I mean, even though the hospital like room was nice, and I can show you a clip of that now, it's still not my house. I haven't had a cycle outside of my house in ages. So it was just like, this is not me. I don't even have my facilities. Like, I ain't even got my things. Like, it was just an awkward time. So yeah, day 8. But I'm going to now call it day 1, because this is the day I had the CAR T therapy and the day I had the infusion. If I'm honest, guys, the process was actually so underwhelming in comparison to, you know what I mean? You think this is going to be like the cure and anything, and it's just like, it's quite underwhelming, but it was what it was. So the process took a while. So they put the cannula in my arm. So they put it in, I think they put it here. So we put cannula, they put it on now. Oh no, they put it in my arm, sorry. They put it in my arm. This arm, I think they put it in my right arm, sorry, at 1 p.m. And I had to keep my arm straight. I was supposed to be given the medication or the drugs, the treatment, at 2 p.m. as opposed to, and I put it in for 1. So keeping it in for an hour, keep my arm straight for an hour, fine. but there was some sort of mix up in trying to confirm the serial numbers, and it just took a long time. So ultimately, I think I was infused at like maybe 3:45. So my arm was straight for so long. So by the time they snatched the cannula out of my hand or my arm, it was like 4 p.m. So my arm was literally in pain. But it wasn't in pain because of the infusion. But yeah, I guess when it comes out, because it's like minus, I don't know, degrees. So when it comes out like with some sort of, but that was the only cool part. But other than that, it was fine. So they initially indicate that you will have symptoms within the first 48 hours. So that was what the people then were on the lookout for. But thankfully, in the first 48 hours, I didn't have any symptoms. I had zero symptoms. So I was like, this is day 1, counting back now 10 days, and day 10, I can leave. So I'm like, okay, boom. The journey has finally started. And it was good because the times at the hospital, they were uneventful, and that's what you want. You don't want anything exciting like, oh, I got a fever, or I got this. You don't want none of that. I wanted a very uneventful time. And myself and another patient that is also on the same treatment, we connected through some other means. So it was nice to hear, it was nice to have somebody else's perspective. And with that person, they'd suffered with some fever. So I was like, oh gosh, I really don't want to suffer with that. But of course, everybody's different. But the fact that then I started panicking a little, because I was like, oh my gosh, I really don't want fever, and that meant to stay longer. So I was like, oh gosh, da, da, da. But I tried to be like, let me still keep up some stuff. Let me try walk a bit. Let me try like be on job. Let me try and move every hour. Now, did I always do that? No. But day 1 for me was fine. I had no symptoms. Now, day 2 was also uneventful, but I was told I needed a blood transfusion. Again, this is based off of me having a period, because I was bleeding. And this pill was supposed to stop me from bleeding. Also, they gave me an injection, like I mentioned previously, to quieten down my uterus so the chemo doesn't affect my my reproductive organs. But I don't know if it meant it worked or didn't work. But my period, my body was still active because I had a period. And off the back of that, I needed a blood transfusion. And again, it's so annoying because, again, if they needed to, if I knew this was a potential, I would have so basically, guys, I take my pill in a specific way where I can choose when I have my period or whatever. So that's why it would have been better if they told me in advance, because I could have forced myself to have a cycle prior to coming into the hospital. So I wouldn't even have needed to be on any type of pill, because I would have had the period like the week beforehand. So again, that was quite annoying. So I needed a blood transfusion, and I've never had one before. So it was kind of like, it's a shame that I had one, but it's not a big deal. It really, really isn't a big deal. It's just a blood transfusion. So yeah, and it's because, and in general, CAR-T therapy can decrease your hemoglobin, which is what we were trying to increase using the blood transfusion. So it was what it was. They explained to me some certain things that like they can't really find a perfect match for you, like perfect match in respect of like every single thing to do with a blood transfusion. So they were explaining that, for example, with me getting pregnant in the future, I would need to be on the lookout for like me potentially have been given antibodies for things like antibodies that won't do anything bad to me but could do something to my baby. And I think they called it like Jones or Jonas or something. Like, if y'all have been pregnant before, y'all maybe know about it, but like it was just something. I think it's like when your baby comes up with like yellow skin or something like that. It's not like, I don't think it's the end of the world from what they said, but it was something that, you know, if I got pregnant, they would be on my record. I would raise it. They would look out for it and everything like that. But it didn't seem like a bad thing. But that's what I'm saying. I was like, oh, don't want to get that blood transfusion. But it's fine. It is what it is. I think with the therapy going forward, I think they need to be more focused on the reproductive and the fertility part, because I think it's such a big part that I think they're more concerned about the lupus, which is fine, of course. That's what we're here for. But I think the fertility part and the like just the reproductive organs part, I think there needs to be a larger focus on that, because that is a big part, especially for a woman. It's a big part, which is why I didn't want the other drug, because that was going to mess up my fertility. So it would be nice if there was more like conversation about that earlier on, so things like, so arrangements can be put in place in the event of X, Y, and Z. But anyways, that's fine. That is what it is. It's a trial, it's still new, they're learning. So these are just things that we'll just, continue to do. So day 3, I actually have the blood transfusion. Where's my notes? So day 3, yeah, I have the blood transfusion. It was fine. It was fine. So there was nothing really much there. Day 4 was uneventful. They said I might need another blood transfusion, but then they did tests and I didn't require one. But at that point, I was neutropenic, which basically means that my ability for my body to fight off infections were low. And I think maybe day 11 was when my family came over. Child, I'm telling you guys, my family, why were they arguing in the hospital? Like, they don't even know how to act. I swear that it was actually crazy. But they brought me a bunch of food and it was nice to see them. And you know what I mean, we all had face masks on. And it's so crazy because I used to think, oh my gosh, why are people still wearing face masks in 2025? I used to like, not even on a mean thing, but I used to laugh at me, oh, those people are being so extra. Now I'm one of those people, I have to wear face masks everywhere I go outside. Like, everywhere I go outside, like I quickly went on the train, which I'm not supposed to go to, but I quickly went on the train quickly, just one stop, and I had gloves on as well, and my big boy face mask. Like, I'm not playing with my health. So now it's good to, like, just because people are wearing face masks, it's not because they think they're all that. It's simply because they actually might need it for their health. So I thought it just gave me a bit more perspective, because I was just thinking, why they still got masks on in 2025? But because they might have health issues, duh. So that I was in neutropenic on day 4, and then I was even more neutropenic on day 5. So that's what made me super paranoid. I was like, if I was going to catch a fever or an infection, this would be the time, because my immune system is so low at this point. Nicole from the future, my friend would hate me if I didn't mention that he came and visited me on day 5, and he brought me McDonald's, and we had a little kiki, and it was nice. We went to the terrace, and I was able to even just breathe in some fresh air. But you know, like, and other people wanted to come see me, but because I was neutropenic at this point, I was like, no. But yeah, it was nice that he came and visited me, and like, you know, I mean, that's my babe. I speak to him every day anyways. But yeah, he would probably bag me up if I didn't say something. So yeah, he came to see me. So now I got to day 6, and again, I was still quite low in my neutropenic, my neutrophils. My neutrophils were still low. So yeah, and like I said, the person that I connected with, they got a fever, I think day 5 or day 6. So because I was day 6, I was like, oh, God forbid it becomes me. That I started to get a bit paranoid, and I was like, oh, am I going to get a sore throat and da-da-da. I think I was overdoing it. I think I was giving myself like I was giving myself, or I was, at least the anxiety of it was making me feel like, oh, well, do I have a sore throat? Oh, is this or is that? But it was fundamentally fine. And then, yeah, I just had to drink more, because they were thinking that, like, because of the kidney problems, they were advising me to drink more, but fundamentally nothing actually happened on day 6. Day 7 was, again, uneventful, but it was nice because that was the first day I actually was allowed out to go for a walk. Or I think I was always allowed out, but I just never asked. But the nurse was like, you can go out for a walk. And it was so nice to actually get some fresh air. Again, had face mask on and had my scarf on, and it was really hot walking. But it was a nice day. It was nice just to be outside again. I think I got McDonald's for lunch as well, which was nice because, girl, like, every day having hospital food. Hospital food wasn't bad, though. I'll give it to them. Like, hospital food was not that bad. Like, I'm telling you, I don't know if y'all know, but hospital cake and custard will always slap will always slap so hard. I had that, like, every single day. I'm not even joking. Every single day. Which is why I didn't lose I didn't lose weight. I definitely gained weight in the hospital. Mind you, 1, I'm not walking, and then 2, I'm eating cake and custard every day. It didn't give that. It did not, let me think I was going to lose weight. I actually played myself. But anyways, that day was nice. It was nice to stretch my legs, whatever. And my white blood count and my neutrophils were increasing a little bit. But it was increasing. Day 8 was uneventful. So nothing to discuss over there. Day 9 irritated me because they do observations every 4 hours. So every 4 hours since I was admitted onto the ward. So this was from the start of the day, it would be 2 a.m., 6 a.m., 10 a.m., 2 p.m., 6 p.m., 10 p.m., and then repeat. So they did obs 6 times a day on me. And the 6 a.m. one, I had a fever. Or was because I had high temperature. My temperature was 38.4, and anything over 38 is considered a fever. And I was so irritated because, guys, that was day 9 for me. I was 1 day from going home, and I had 1 high fever and 1 high temperature, and it was irritating me because I'm like, now I can't go home tomorrow because they need to investigate if do I have an infection, they have to investigate. And I'm thinking, God in heaven. Like, I felt fine the whole time. There was not one moment during that hospital stay that I felt like I was feverish, like I was sick, like anything. I didn't feel anything. So for me to have that one high temp irritated my whole spirit, because I was just like, sometimes, guys, when I sleep, I sweat. So I'm thinking it's probably that. But no. So they automatically put me on antibiotics and put me on paracetamol, and I had to have that every 8 hours for 2 days. And in order for me to go home, I had to have the antibiotics for 2 days, and then 1 day of no issues, of no high temp, and I'll be able to go home. So that meant around Sunday I'll be going home, but initially I was supposed to go home on Friday. So that really irritated me, because I was just like, now the hospital stay was fine. I was playing Sims. I was very governed by OBS and food, and like I'll talk on the phone and I'll do my reviews, you guys know. So it wasn't bad at all. But then at that point it was like, now it's getting long. Now I'm here for too long. Now I'm getting irritated, because even like day 10. Again, very uneventful. Nothing happened. Like, there was no high temp, but every single time they were doing my observation, I was super duper nervous. So sometimes my blood pressure would be going up, because that's a part of your observation. They'll do your temperature and they do your blood pressure. But it was going up, because I was like, I'm so nervous, and I had to try to calm down and breathe, because it was just annoying. So day 11, I wrote down I was sick and tired. I was becoming irritable. I started having some diarrhea. I think it was just because I was dehydrated. I think I've been having diarrhea. I'd been having diarrhea, and I was thinking, so I was researching in ChatGPT, and I'll be honest, that high temperature can come from dehydration. And of course, when you have diarrhea, you can have high temp, because you can have dehydration, which can lead to high temperature. So that was annoying me, because I was like, I wasn't sick other than like having little bits of diarrhea. So that was quite annoying. So yeah, I just made sure I kept hydrated. And I had no signs of infection or flu. I wasn't coughing. I wasn't sneezing. Didn't have sore throat. I wasn't nauseous or none of those things. I was completely fine. So yeah, all of those days were long. And I don't even have an entry for day 12, because day 12 is the day I thankfully went home. So I've been back now 2 weeks today, which is amazing. I'm so grateful to be at home. I think to appreciate my home more, and even just appreciate being able to go to the shop, being able to breathe fresh air, being able to not just be like hospital definitely wasn't given lock-up, but I think towards the end it was given lock-up. So I'm just so grateful that, again, these last 2 weeks has been quite uneventful. I've been to the hospital a couple times, like to do regular checkups. It's a part of the trial, and I've gone a couple of times, and I've had another blood transfusion. I had a blood transfusion on Tuesday, so hopefully I don't need to have any more. Guys, I even had to inject myself. Guys. I was going to do a video on it, but as in like, I was going to record it, but I did it so late last night and I could not be asked to record it. But yeah, I had a small injection just to promote my red blood cells to regenerate and to reproduce themselves, because my red blood count was quite low. So, and my hemoglobin again was quite low, so I had to try and bring it back up. So I had that medication, and now I'm on folic acid, and I'm on a bunch of different medication now. I have like a medicine organizer, and I'm on a bunch of different medication that I have to take at certain times during the day, which is all fine. That's all been fine. Yeah, it's been okay. It's been okay. There hasn't been no hassle. I can't take public transport, so I've just been taking Ubers everywhere. Well, not everywhere. I've been to my mum's once, and then to the hospital and back. So, and the sponsor pays for that anyway, so that's fine. And I haven't really done anything outside the house. I haven't gone to the gym, because for me, gym is like infection place. I haven't even been too far to even go shopping for food. I haven't really seen any friends. Like couple of my friends came over and gave me gifts and stuff like that. It was so sweet. It was so nice to see them. And then I have my day 28. My day 28 appointment tomorrow. So just to see like how it's going to be. And then like I said, I've been going to the hospital a couple of times this week and last week. But then now, come tomorrow, I'll be going to the hospital only once a month. Unless I need something, then I can call them and say, oh, I'm having this thing. Should I go A&E, or what do you advise I do? Another Nicole from the future. So currently I have no symptoms of lupus at all. I have fatigue. What fatigue is from could be also just from the CAR-T therapy itself. But joint pain, muscle pain. I never had butterfly rashes. Even thankfully after the chemo, I redid my braids. Hello. and more hair did not come out than usual. Like, I had my braids in for like 2.5 months. I'm not even joking, nasty work. But my hair, no more hair than what would shed came out. So that's also a really good thing. So I'm very, very positive about what the future looks like, because I don't have any, or like I haven't had any swollen lip, y'all know. I haven't had any like swelling like that. So my lupus symptoms have been like basically non-existent, other than fatigue, which can come from the chemo, but also from the CAR-T. I don't really know how long it takes for like chemo to wash out your body completely, but the CAR-T therapy, of course, is still very, very active in me and is doing its thing. So there will be days where I'm more fatigued than others. Like yesterday, I was extremely bummy, like I said, but today, I've been good. Like, I've done what I needed to do. But yeah, so it's good. And I think at the moment, things are looking good for me, even though I've had like the blood transfusion. Fundamentally, like, because of course you guys know I mentioned the Chicago trip. My white blood cells at the moment are really good, and my neutrophils are really good. They're in the like normal range, and even one of my doctors told me that my lupus, like the things that people, like how you identify or diagnose someone with lupus, some of my stuff is negative. Like a lot of it is negative, so it's like, it's almost getting to the point like, do I have lupus? Like, so we're getting to that point, which is really, really good. And I said to you that most people are in remission, or all the people are in remission are like around the 3-month mark. So if that's what it's looking like right now, then hopefully like my kidneys will start operating correctly, because that's the main reason why I'm even on this trial, because of the effect to my kidneys. So I'm very, very positive. Sometimes I'm quite fatigued, I'll be honest. That's the symptoms that I have. Like when I say yesterday, guys, I was in and out of sleep the whole day. I had 2 meals, I was in and out of sleep the whole day. I've had weight gain, which is not lovely, but it's not too much, I'll be honest. Like, I'm like 10 stone 1 right now, but the highest I've been like was like 10 stone 6. Guys, I've never been 10 stone 6 in my life. Like, it wasn't like closely in fit, but it just was bigger. And then I also currently have something called pitting edema. I'll put up a picture, because now that's added to my weight, because it's just like, my body's not like, the fluid in my legs are just staying in my legs. I'm not releasing them, which is quite annoying. But again, it's not really a big deal. So I don't really have anything to really complain about. I'm just living life. And I'm just excited as time goes on, how I'm going to feel even more better, and I'm going to feel more energized. And yeah, but guys, that's really it for my lupus update. If you guys have any questions, please let me know. And yeah, thank you for watching this video. Please don't forget to like, comment, and subscribe. I really appreciate it. And I'll see you in my next video. Bye.